The liver. The liver is an important organ that does hundreds of jobs that are vital for sustaining life. For example, the liver stores glycogen, a type of fuel that body needs for energy. Liver makes bile, which helps us digest fats. Liver makes substances that help blood to clot and repair damaged tissues. Liver processes and removes alcohol, toxins or medicines from the blood. Liver helps the body fight infections. Your liver is very tough. It'll keep working even when it's damaged and can continue to repair itself until it's severely damaged. Cirrhosis is scarring, fibrosis, of the liver caused by long-term liver damage. The scar tissue prevents the liver working properly. Cirrhosis is widely prevalent worldwide and can be a consequence of different causes. They include obesity, non-alcoholic fatty liver disease, high alcohol consumption, hepatitis B or C infection, autoimmune diseases, cholestatic diseases, and iron or copper overload. Cirrhosis develops after a long period of inflammation. It results in replacement of the healthy liver parenchyma with fibrotic tissue and regenerative nodules, leading to portal hypertension. The disease evolves from an asymptomatic phase, compensated cirrhosis, to a symptomatic phase, decompensated cirrhosis. The complications of which often result in hospitalization, impaired quality of life, and high mortality. Progressive portal hypertension, systemic inflammation, and liver failure drive disease outcomes. The management of liver cirrhosis is centered on the treatment of the causes and complications, and liver transplantation can be required in some cases. Better screening for early fibrosis or cirrhosis, early identification and reversal of causative factors and prevention of complications are needed. Cirrhosis is sometimes called end-stage liver disease because it happens after other stages of damage from conditions that affect the liver, such as hepatitis. Your liver may keep working even when you have cirrhosis. However, cirrhosis can eventually lead to liver failure, and you can get serious complications, which can be life-threatening. Treatment may be able to stop cirrhosis from getting worse. Symptoms of cirrhosis. You may not have any symptoms during the early stages of cirrhosis. As your liver becomes more damaged, you may feel very tired and weak, feel sick, nausea, lose your appetite, lose weight and muscle mass. You may get red patches on your palms and small, spider-like blood vessels on your skin, spiderangiomas, above waist level. If cirrhosis gets worse, some of the symptoms and complications include yellowing of the skin and whites of the eyes, jaundice, vomiting blood, itchy skin, dark pee and terry-looking poo, bleeding or bruising easily, swollen legs, edema, or tummy, ascites, from a buildup of fluid, loss of sex drive, libido. See a doctor if you think you may have cirrhosis. Diagnosing cirrhosis. If your doctor suspects cirrhosis, they'll check your medical history and do a physical examination to look for signs of long-term liver disease. You may have tests to confirm the diagnosis, such as blood tests, scans, such as an ultrasound, CT, MRI, or transient elastography scan. A liver biopsy, where a fine needle is used to remove a sample of liver cells so they can be examined under a microscope. If tests show that you have cirrhosis, a GP should refer you to see a doctor who specializes in liver problems, hepatologist. If you have complications from cirrhosis, or a high chance of getting complications, you may be referred to a specialist liver center. Causes of liver cirrhosis. A wide range of diseases and conditions can damage the liver and lead to cirrhosis. Some of the causes include chronic alcohol abuse, chronic viral hepatitis, hepatitis B, C and D. Fat accumulating in the liver, non-alcoholic fatty liver disease. Iron buildup in the body, hemochromatosis. Cystic fibrosis, copper accumulated in the liver, Wilson's disease. Poorly formed bile ducts, biliary atresia, alpha-1 antitrypsin deficiency. Inherited disorders of sugar metabolism, galactosemia or glycogen storage disease. Genetic digestive disorder, Alagille syndrome. Liver disease caused by your body's immune system, autoimmune hepatitis. Destruction of the bile ducts, primary biliary cirrhosis. Hardening and scarring of the bile ducts, primary sclerosing cholangitis, infection, such as syphilis or brucellosis. Medications, including methotrexate or isoniazid. Risk factors for liver cirrhosis. Drinking too much alcohol. Excessive alcohol consumption is a risk factor for cirrhosis. Being overweight. Being obese increases your risk of conditions that may lead to cirrhosis, such as non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. Having viral hepatitis. Not everyone with chronic hepatitis will develop cirrhosis, but it's one of the world's leading causes of liver disease. Stages of cirrhosis. If you find out that you have cirrhosis, your doctor will tell you what stage you're in. Depending on how well your liver is working, they'll say it's either compensated or decompensated. Which one it is makes a difference in the kind of treatment you get. Compensated cirrhosis. If you have compensated cirrhosis, you won't have any symptoms. Your liver can still do its job because there are enough healthy cells to make up for the damaged cells and scar tissue caused by cirrhosis. You can stay in this stage for many years. Decompensated cirrhosis. Decompensated cirrhosis is the stage that comes after compensated cirrhosis. At this point, your liver has too much scarring and you develop complications. Your doctor will know you have decompensated cirrhosis if you show signs of one or more of these conditions. Jaundice, it's caused when your liver can't get rid of bilirubin, a blood waste product, which can make your skin and eyes yellow. Ascites, this is fluid buildup in your belly. Bleeding varices, varices are enlarged blood vessels. Signs that you have bleeding varices are black, tarry, or bloody stools or throwing up blood. This is an emergency that needs treatment right away. Hepatic encephalopathy, toxins can build up in your brain and make you confused and very tired, and have trouble doing daily activities like driving or writing. Your liver disease can also lead to a kidney disease called hepatorenal syndrome, a lung disease called hepatopulmonary syndrome, and liver cancer. Complications of cirrhosis can include high blood pressure in the veins that supply the liver, portal hypertension. Cirrhosis slows the normal flow of blood through the liver, thus increasing pressure in the vein that brings blood to the liver from the intestines and spleen. Swelling in the legs and abdomen. The increased pressure in the portal vein can cause fluid to accumulate in the legs, edema, and in the abdomen, ascites. Edema and ascites also may result from the inability of the liver to make enough of certain blood proteins, such as albumin. Enlargement of the spleen, splenomegaly. Portal hypertension can also cause changes to swelling of the spleen, and trapping of white blood cells and platelets. Decreased white blood cells and platelets in your blood can be the first sign of cirrhosis. Bleeding. Portal hypertension can cause blood to be redirected to smaller veins. Strained by the extra pressure, these smaller veins can burst, causing serious bleeding. Portal hypertension may cause enlarged veins, varices, in the esophagus, esophageal varices, or the stomach, gastric varices, and lead to life-threatening bleeding. If the liver can't make enough clotting factors, this also can contribute to continued bleeding. Infections. If you have cirrhosis, your body may have difficulty fighting infections. Ascites can lead to bacterial peritonitis, a serious infection. Malnutrition. Cirrhosis may make it more difficult for your body to process nutrients, leading to weakness and weight loss. Buildup of toxins in the brain. Hepatic encephalopathy. A liver damaged by cirrhosis isn't able to clear toxins from the blood as well as a healthy liver can. These toxins can then build up in the brain and cause mental confusion and difficulty concentrating. With time, hepatic encephalopathy can progress to unresponsiveness or coma. Jaundice. Jaundice occurs when the diseased liver doesn't remove enough bilirubin, a blood waste product, from your blood. Jaundice causes yellowing of the skin and whites of the eyes and darkening of urine. Bone disease. Some people with cirrhosis lose bone strength and are at greater risk of fractures. Increased risk of liver cancer. A large proportion of people who develop liver cancer have pre-existing cirrhosis. Acute on chronic cirrhosis. Some people end up experiencing multi-organ failure. Researchers now believe this is a distinct complication in some people who have cirrhosis, but they don't fully understand its causes. Prevention of liver cirrhosis. Reduce your risk of cirrhosis by taking these steps to care for your liver. Do not drink alcohol if you have cirrhosis. If you have liver disease, you should avoid alcohol. Eat a healthy diet. Choose a plant-based diet that's full of fruits and vegetables. Select whole grains and lean sources of protein. Reduce the amount of fatty and fried foods you eat. Maintain a healthy weight. An excess amount of body fat can damage your liver. Talk to your doctor about a weight loss plan if you are obese or overweight. Reduce your risk of hepatitis. Sharing needles and having unprotected sex can increase your risk of hepatitis B and C. Ask your doctor about hepatitis vaccinations. The treatment for cirrhosis depends on what has caused it. Cirrhosis cannot usually be cured, but there are ways to manage the symptoms and any complications, and stop the condition getting worse. Lifestyle changes. If you have cirrhosis, there are several lifestyle changes you can make to reduce your chances of further problems and complications. These include: avoid alcohol, quit smoking, lose weight if you're overweight or obese. Do regular exercise to reduce muscle loss. Practice good hygiene to reduce your chance of getting infections. Speak to a GP about vaccinations you may need, such as the annual flu vaccine or travel vaccines. Speak to a GP or pharmacist if you're taking over-the-counter or prescription medicines, because cirrhosis can affect the way some medicines work. Dietary changes. Malnutrition is common in people with cirrhosis, so it's important you eat a healthy, balanced diet to help you get all the nutrients you need. Cutting down on salt can help reduce the chance of swelling in your legs, feet and tummy caused by a buildup of fluid. The damage to your liver can mean it's unable to store glycogen, which is a type of fuel the body needs for energy. When this happens, your muscle tissue is used for energy between meals, which leads to muscle loss and weakness. This means you may need extra calories and protein in your diet. Eating healthy snacks between meals, or having 3 or 4 small meals each day, rather than 1 or 2 large meals, may help. Medicine for liver cirrhosis. The medicine you need will depend on what caused the damage to your liver. For example, if cirrhosis is from long-term viral hepatitis, you may be prescribed antiviral medicine. Medicines for cirrhosis. You may be offered medicines to ease the symptoms of cirrhosis, such as diuretics are used in combination with a low-salt diet to reduce the amount of fluid in your body, which helps with swelling, edema. Medicine prescribed to help with high blood pressure in the main vein that takes blood to the liver, portal hypertension. Prescription creams to ease skin itching. Managing complications. If cirrhosis progresses and your liver is no longer able to function, decompensated cirrhosis, you may get complications that need treatment. When cirrhosis has progressed, it can cause the veins in your food pipe, esophagus, or stomach to become swollen. These are called esophageal varices and gastric varices. An endoscopy is used to diagnose esophageal and gastric varices. You may be given a type of medicine called a beta blocker, such as propranolol, to reduce the chance of the varices bleeding, or to help control bleeding. If you vomit blood, or have blood in your poo, it may be because the varices are bleeding, a variceal hemorrhage. You will need urgent treatment. Go to your nearest A&E department immediately. There are several treatments used to prevent or stop the bleeding, such as medicines and fitting a band around the veins, endoscopic variceal band ligation. A buildup of fluid in your tummy area, ascites, or legs and ankles, peripheral edema, is a common complication when cirrhosis progresses. The main treatments are cutting out salt from your diet and taking a type of medicine called a diuretic, such as spironolactone or furosemide. If the fluid in your tummy becomes infected, you may need antibiotics. In severe cases, you may need to have the fluid drained from your tummy area with a tube. Cirrhosis can sometimes cause problems with your brain function, encephalopathy. Symptoms include confusion, feeling sleepy, and problems concentrating. This happens because the liver is no longer able to clear toxins properly. The main treatment for encephalopathy is lactulose syrup. This acts as a laxative and helps clear toxins from your body. You may also need to take an antibiotic called rifaximin, to prevent infection. Bleeding. Cirrhosis can affect your liver's ability to make your blood clot. It means there's a chance of severe bleeding if you cut yourself or have an operation or dental work. You may be given medicines, or a blood product called plasma, to prevent or treat bleeding. Talk to your doctor about your condition and the risk of bleeding before having an operation, including any dental work. If cirrhosis progresses and your liver is severely damaged, a liver transplant may be the only treatment option. This is a major operation that involves removing your diseased liver and replacing it with a healthy liver from a donor. You will not be able to have a liver transplant if cirrhosis was caused by alcohol-related liver disease and you continue to drink alcohol. Diabetes may get worse if you have type 2 diabetes and develop cirrhosis. This is because cirrhosis can increase your resistance to insulin, a hormone produced by the body to control blood sugar levels. Having cirrhosis increases the chance of liver cancer, most commonly a type called hepatocellular carcinoma, HCC. Many symptoms of liver cancer are the same as symptoms of cirrhosis, so regular checks for liver cancer are important. You should have an ultrasound scan, and may also have blood tests, every 6 months to check for HCC.